Fellow Guyanese, I am Dr. Karen Gordon-Boyle and welcome to today's COVID-19 update. Regrettably, the update of the situation in Guyana is not available at this time due to the blackout that occurred this morning in Georgetown. The lab is now currently running the tests and the results, which will be ready later this afternoon and will be posted on the Ministry of Public Health dashboard. In yesterday's briefing, we referred to the continuous increase in the number of cases in Guyana, as well as the stark situation in the Mabaruma Subdistrict, Region 1, where all the new cases were recorded. The situation in our country is becoming increasingly alarming, especially over this past week. We have recorded the highest number of cases since the beginning of the COVID-19 pandemic in our country. Fellow Guyanese, Guyana, compared to other countries, has a very high COVID-19 death rate. Currently, 6% of all infected cases have died. For a country with less than 1 million inhabitants, this rate is very high. We have been pleading with all residents across our beloved country, particularly in regions 1, 4, and 7, to act responsibly and comply with the guidelines. Friends, if the number of positive cases and deaths are not evidence enough of the presence and effects of COVID-19, then we are in a very terrible position in our response to this disease. I must make it clear that the measures instituted by the Ministry of Public Health are consistent with the management of highly contagious diseases. The health system is already overburdened with responding to this current situation, and if this becomes worse, then we will not be able to manage, and what is happening in next door Brazil will become our reality. So I launch an appeal yet again to the young in our population, especially our 20 to 29-year-olds, who have been openly disregarding the regulations, to reflect on their behavior and ponder on the way this lifestyle is contributing to the COVID-19 situation in our country. For fear of repeating myself, I wish to state that in Guyana, the coronavirus disease is not exclusive to the elderly, but as the statistics have shown, our males in the age group mentioned above have been most vulnerable. Further, we have discussed the potential damage that COVID-19 can cause. Are we so uncaring about our life that we have no regard for the future, for our offspring? I ask you to share a thought to the potential you all possess and the waste of that precious gift that will result if you continue blatantly in this current vein. Remember, all it demands is a little effort that is not costly on your part. Our health workers are resolutely doing their part, so why can't you? I wish to remind all those who have been adhering to the health guidelines not to relax their efforts. Your adherence has helped the ministry thus far in mitigating the spread of this disease. We commend your effort and encourage you to continue demonstrating your civil responsibility. In our stores, we begin to see some patrons not wearing masks and flouting the physical distancing regulations. Even our cashiers are handling money and citizens' purchases without constantly sanitizing. These are the measures that have helped us so far, but which we are neglecting to go through with. I implore you to do the right thing. We wish to reiterate, especially to the repatriates, that a negative COVID-19 test on entry is not a guarantee that you will not test positive in a few days' time. So we make the call once more for you to remain in quarantine until the time is up. Quarantine means that there is no visiting of friends or family. Please remind family and friends to bring their thermometers with them so that temperatures can be recorded. We wish to indicate that with the generous donation from our partner, UNHCR, of prefabricated housing units, we have managed to expand screening to Bokhol, Region 3, Aranca, Region 7, and will continue to expand services in other locations where they aren't readily available. We must say special thank you for all the communities and agencies whose volunteers continue to support the various services offered by the Ministry of Public Health during this pandemic. Fellow Guyanese, Please remember that all our efforts have been set up not to harm you, but to preserve your life. We can only do what we can. The rest is up to you. And remember, your carelessness unnecessarily puts our healthcare workers' lives at risk. Do your part, respect the curfew, wear a mask, practice physical distancing, wash your hands frequently, and only venture out if absolutely necessary. Stay home and stay safe. Thank you.